The goal of this video lecture is to review the symptoms and diagnostic criteria for alcohol use disorder, which is one of our substance use disorders. So in general, when we're talking about alcohol use disorder, we're talking about a problematic pattern of alcohol use that leads to clinically significant impairment or distress. And specifically in the DSM, we're going to require that this be manifested by at least 2 symptoms occurring within a 12-month period. And we can characterize alcohol use disorder in terms of severity on the basis of how many symptoms a person is experiencing. So a mild alcohol use disorder would be characterized by 2 or 3 of the following symptoms. 4 or 5 symptoms would be classified as a moderate alcohol use disorder, and 6 or more symptoms would be classified as a severe alcohol use disorder. And we can describe these symptoms as falling into several categories. I want to be clear to note that unlike post-traumatic stress disorder, these are not groups of criteria. So remember, with PTSD, you had to have a certain number of symptoms from each category. That's not the case for alcohol use disorder. So you can have any combination of at least 2 symptoms from this set, but I'm hoping that describing these in groups that share different characteristics will help you remember the different symptoms of the disorder. So one set of symptoms have to do with impaired control over alcohol use. So the thing that these symptoms share is that the person has an inability to control their drinking behavior or their alcohol use. So these symptoms include things like drinking larger amounts over a longer period than intended. So unlike a person who is intending to remain abstinent from alcohol, some individuals with an alcohol use disorder may intend to drink, but they may set guidelines for themselves. So I will only drink for a certain amount of time, or I will only have a certain number of drinks. Evidence for impaired control would be that when a person sets these personal guidelines, that they are exceeding that. So if they say, I'm just going to go out and have 2 glasses of wine with dinner, and they consume 4 glasses of wine. Or if they go out and say, I'm just going to go out for happy hour after work, and after an hour I will leave, and they end up staying for longer and drinking for a period of 2 to 3 hours or even longer. So that would be evidence that the person is unable to control their alcohol use. Another way that this can be exhibited is by evidence of a persistent desire to cut down or control alcohol use, or unsuccessful attempts to decrease alcohol use or cease alcohol use. So this might be a person who wants to change their drinking behavior but is unable to, or a person who is repeatedly unable to make those kinds of changes. So they might be unable to stop drinking entirely. They might have repeated efforts to remain abstinent, and then those are interrupted with drinking. Or they might have a desire to decrease their use or restrict their use to certain kinds of situations and be unable to follow through on those attempts. So all of those would also be evidence that a person is unable to control their drinking behavior. Another way that impaired control can be exhibited is when a person spends a great deal of time in activities related to drinking. So that might be spending a lot of time obtaining alcohol, spending a lot of time drinking or under the intoxicating effects of alcohol, and can also include time spent recovering from the effects of alcohol. So when a large portion of a person's experience is related to drinking behaviors, so either they're figuring out how to get access to alcohol, figuring out where they're going to go drink next, a large portion of their day is spent under the effects of alcohol or recovering, for example, from the effects of a hangover, this also suggests that they are losing control of their drinking and are unable to moderate their drinking behavior. So all of these are evidence that an individual has impaired control of their alcohol use. Cravings are a new symptom that was added to the DSM-5, and this is also seen as evidence that a person has impaired control over their drinking behavior. So a strong desire to use alcohol, and kind of when the intensity of this craving prevents a person maybe from thinking about other things. Our next set of symptoms of problematic alcohol use have to do with social impairment, so relationship and social consequences associated with problematic drinking behaviors. So these can include things like recurrent alcohol use that results in a failure to fulfill major role obligations. So you can consider the various obligations that a person might have if they are an employee, if they are a student in their role as a parent or a caretaker, that if alcohol use results in impairment to those major obligations, that's a sign that the person is experiencing problems related to their alcohol use. So for example, if a person has frequent absences at work or frequent latenesses due to the consequences of drinking, for example, hangovers. It might also be that the person has impaired work performance, so maybe they are going to work, maybe they're going to work on time, but maybe their employer has noticed a change in their work quality, maybe impairment in their relationships at work, for example, related to inappropriate drinking behaviors, socializing after work or at work holiday parties, so problems fulfilling obligations at work related to drinking behaviors. You can see the same kinds of impairments in a school setting, so frequent absences from class, absences from early morning classes related to hangovers, impaired academic performance related to alcohol use would all be evidence for problematic alcohol use. And also failure to fulfill obligations at home. So it might be related to parenting behaviors, forgetting to pick kids up from school, bringing kids to school late because everybody doesn't get out of the house on time in the morning, or just impaired caretaking relationships. So spending less time with children because a parent is drinking rather than engaging in other kinds of activities with their children. So all of that would be evidence of social impairment related to alcohol use. You can also see continued alcohol use despite recurrent social or interpersonal problems that are either caused by the effects of alcohol or exacerbated by the effects of alcohol. So these can be conflicts specifically related to the alcohol use. So for example, if a person who is in a relationship with the person who is drinking has concerns about the drinking behavior, this can be a source of conflict. So if this is causing significant interpersonal conflict, for example, with a parent or romantic partner, and the individual continues to drink, that suggests that there's problems resulting from this drinking. Or it might also be other kinds of interpersonal problems that may be exacerbated by the effects of alcohol. So for example, volatile interpersonal relationships or relationship conflict that's not directly related to the drinking, but that might be exacerbated by the drinking. So for example, if the person is more impulsive or more likely to engage in conflict when they are drinking, the fact that they continue to drink despite the fact that it's exacerbating that relationship conflict can be another sign that they're experiencing social problems related to their drinking behaviors. And another way that you can see this is that people may give up or reduce their involvement in social activities or other important kinds of activities due to their alcohol use. So it might be cutting back on social interactions, for example, spending less time with friends who don't drink. It might be giving up or cutting back on occupational things, so spending more time drinking, which takes time away from the workplace, or giving up recreational activities, either because maybe drinking is taking up more time, or because the drinking is impairing someone's ability to engage in those recreational activities. So for example, somebody might be involved in a recreational activity that they need to drive to, and they might make a safe decision that because they need to drive there, that if they are regularly drinking and would have to drive while intoxicated to get there, they might decide to quit that activity. So on one hand, that's a safe decision because they're choosing not to drive while under the effects of alcohol. But on the other hand, the fact that they need to make that decision and cut back their recreational activities because of the consequences of their drinking suggests that they are having problems related to this drinking behavior. So cutting back on social behaviors, cutting back on occupational behaviors, changing the kinds of recreational things that you are doing or spending less time on these important activities, all of these are evidence that a person is experiencing social problems related to their alcohol use. Our next set of symptoms are classified as risky use. So all of these are symptoms that suggest that a person is drinking or using alcohol in situations where it could be hazardous. So these include things like recurrent alcohol use in situations in which it could be physically hazardous. So this includes things like recurrent alcohol use followed by driving. Might also include things like use of alcohol when operating heavy machinery or in a workplace where alcohol use could be dangerous. Use of alcohol before going into the ocean or going swimming, another kind of situation where alcohol use and impairments in judgment could be physically dangerous. So any kind of evidence that the person is recurrently drinking or using alcohol in a situation where that alcohol use could put them in a context where they're at risk for physical harm. And another way that we can see this is continued use despite knowing that the alcohol is causing or contributing to an underlying physical or psychological problem. So this can be used despite knowing that alcohol is leading to some kind of physical illness. So for example, alcohol use can be related to liver damage, to pancreatitis, to a really wide range of medical problems that are directly caused by the alcohol use itself. So when an individual continues to use alcohol despite knowing that the alcohol is causing or contributing to these medical problems, that's evidence that the drinking behavior is causing problems. And this can also have to do with psychological problems. So for example, in our case example, we saw that she described drinking in response to feeling depressed. But we also know that alcohol use tends to worsen depressive symptoms over time. And many people with alcohol use disorders have insight into this. So they can describe and say, I know that in the short term, sometimes my mood gets better when I'm drinking, but long term, I think that my alcohol use is contributing to my depression. So when an individual continues to drink despite knowing that it's exacerbating an underlying psychological problem, so it might be contributing to depression or contributing to anxiety, that this is another evidence of problematic alcohol use, that they're continuing to use alcohol despite knowing that it's contributing to these physical or medical problems or their psychological problems. And our final set of symptoms are what we call the pharmacological symptoms. So these are evidence of physiological changes associated with recurrent substance use. So one of these symptoms is tolerance. So tolerance is when an individual needs to consume a larger amount of a substance to experience the same effects as a result of repeated ingestion of a substance over time. So there are two different ways that a person can meet criteria for tolerance according to the DSM. So one is that the individual might need increased amounts of alcohol to achieve the same level of intoxication or to achieve their desired level of intoxication. So for example, an individual who is attempting to reach a kind of moderate state of intoxication. So they're trying to get buzzed. Perhaps when they start drinking, they require 3 to 4 drinks to achieve that level of intoxication. Over a sustained period of time of drinking, they may require more alcohol. So 5 to 6 drinks, 7 to 8 drinks. So requiring a larger amount of alcohol to reach that same level of intoxication. Another way that you can meet this criteria is by maintaining the same level of alcohol use, but experiencing diminished intoxicating effects. So for example, that same individual might continue to maintain their initial level of alcohol use. So they might continue to drink 3 to 4 drinks in every drinking episode, but as opposed to their early level of moderate intoxication when drinking that amount, over time they might experience lower and lower levels of subjective intoxication. So both of those, either increasing alcohol consumption to maintain a level of intoxication or maintaining level of alcohol consumption with diminished intoxicating effects, would be evidence that a person is developing tolerance. The other side of this is that we can see withdrawal, and this can also be manifested in 2 ways. So one would be that when the person abstains from alcohol use, that they experience the characteristic withdrawal syndrome. So some of the characteristic withdrawal symptoms of alcohol use are anxiety and irritability. You can also get physiological symptoms such as agitation, increased blood pressure, increased heart rate. Often you'll get insomnia, sometimes you can get GI distress. So that would be the characteristic withdrawal syndrome for alcohol. Or the other way that you can meet this criteria is that instead of going through the withdrawal syndrome, that the person uses alcohol or a closely related substance either to relieve their withdrawal symptoms or to avoid those withdrawal symptoms entirely. So what that suggests is that if a person remained abstinent from the alcohol use, that they would experience those withdrawal symptoms, but because they either continue to use alcohol or because they replace the alcohol with other substances, they never actually experience those withdrawal symptoms. But if a person is either maintaining a stable level of alcohol use to avoid withdrawal symptoms, or if they're replacing alcohol with other substances, and for alcohol use, those would include other depressants, particularly things like benzodiazepines, This suggests that a person would be at risk for withdrawal because they need to continue their alcohol use in order to avoid those withdrawal symptoms. So again, remember that to meet criteria for a diagnosis of alcohol use disorder, a person needs to have at least 2 of those symptoms, and we'll use the number of symptoms that they exhibit to classify the severity of the disorder. So 2 or 3 symptoms would be a mild alcohol use disorder, 4 to 5 would be a moderate, or 6 or more symptoms would be a severe alcohol use disorder.